to share with you how much a medical student in his or her final year needs to read in order to pass the exams and get into internship and then become a doctor. MBBS is a degree which spans around 4.5 years, and after which, if you pass the exams, you will have to undergo a training for 1 year in the hospital as an intern, which is the phase of internship for 1 year. And I am currently in my final year, and I have spent almost 3.5 years in my medical college now. And in this video, I will be focusing mainly on the subjects that I need to read in my final year this year, and how much what is the planning that I have done to for the upcoming exams in my for my upcoming professional exams, university exams in the month of February. So I have also made many videos about how to pass third year final exams and also first year exams. I have given many tips in my previous videos also, and I would like you to go through them. So before wasting any of your time, let's get started about what are the subjects that I need to read in my final year in order to clear my exams. So guys, coming to the subjects that I need to study, there are 4 major subjects: general medicine, general surgery, pediatrics, and obstetrics and gynecology. So guys, coming to general medicine is a very vast subject in itself. On the theory part, in general medicine, we study different systems, diseases related to different systems. Like when it comes to gastrointestinal system, we study about a lot of malabsorption syndromes and also inflammatory bowel disease, and many diseases related to liver, like hepatic and the diseases, chronic liver disease, non-alcoholic fatty liver disease, and many of these things. We also, on our clinical side in medicine, do cases. So guys, apart from the gastrointestinal system, we also study diseases related to respiratory system, cardiovascular system, and the central nervous system. Going briefly into all of these systems, the respiratory system consists of cases like COPD and pneumonia and tuberculosis, which are very prevalent in our part of in our country. And also we study, in the case of cardiovascular system, we study diseases related to valve disorders or endocarditis, these kind of cases. And also when it comes to central nervous system, one of the main cases that is allotted to us for our clinical examinations is the case of stroke. So I think this will cover in brief about the medicine subject as a whole. And this is I think if I go on speaking, I will have to speak a lot about general medicine itself. And in general medicine, we also study about psychiatry and dermatology. Dermatology is a branch which deals with conditions of the skin, and psychiatry deals with diseases of behavioral disorders, and also many disorders like Alzheimer's disease and many of the behavioral disorders. So guys, now coming to general surgery. In the general surgery, we as medical students in our wards and in our OT, we see cases related to appendicitis. Like we see the procedures for removal of the appendix, like appendicectomy, and we see varicose veins cases and peripheral vascular diseases, and also many diseases related to gallbladder like cholecystitis, and many of these cases we see in general surgery. General surgery is a branch under which we also study orthopedics. Orthopedics deals with diseases related to the musculoskeletal system and your bones, including fractures and malignancies of the bone. So these are the things that we study under general medicine and orthopedics. Orthopedics forms part of surgery in our undergraduate curriculum. So guys, now coming to obstetrics and gynecology. Obstetrics deals with mainly the phase when the woman is pregnant, and the care that is given to her as a pregnant woman, and the problems which women face when they are pregnant. and it deals with giving adequate care to the mother and to the growing fetus. So and up to the part when she delivers the baby. This deals with obstetrics, and gynecology deals with the problems that women face in their lifetime. And pediatrics is a subject that is devoted to learning about the diseases of children. We have so guys, now that I have given you a brief introduction about all the subjects that I need to read, the next step, the next thing I would start doing is to arrange the resources that I need to prepare for, like my textbooks and my notes. So once I have prepared my resources, my textbooks and notes, and the previous year questions which are most frequently asked, I plan to make a timetable which I would follow. And in this timetable, I mainly focus on the most important things. Since I have got only just 15 days before my exams, I would focus mainly on the notes from my online coaching classes, and also from the textbook and my university exam previous year question papers, from which most questions will be repeated in our undergraduate examinations. And the next step after making a timetable would be to execute it, and to execute we need a lot of discipline, and also staying away from a lot of your other hobbies, and also trying to I think I need to get a little more secluded and spend more time with myself to read a lot of to cover and to execute the plan that I have made. And at this juncture, I would like to also speak about one of the rules that I have read recently, and I also seen it getting spoken by many of the medical students. It states that around 80% of the important things for your examinations come from 20% of the syllabus, which is called a 20-80 rule or 80-20 rule, something like that. And it states that which is kind of true, and I have experienced this through my last 3 years also. Most important questions are asked from very small topics, like the very short amount of topics of your syllabus. So guys, now coming to the conclusion of this video, I think you might have got some insight into what it's like in a medical school, and what are the process that I need to undergo in order to face an exam. And I hope you must have gained some awareness through this video. And I will be making a lot of videos about life in medical college, and also I'll be trying to make some vlogs in my free time. So if you have gained some knowledge, please do consider subscribing my channel. Thank you.